Now live.
Thank you. Good morning, everyone. I'd like to welcome everyone to this public virtual meeting of the Local Outbreak Engagement Board. Please note that the meeting is being broadcast and recorded. Item 1, are there any apologies for absence?
Chair, I've received apologies from Andrew Hunter.
Thank you. For item 2, please could members of the board turn on your microphone and confirm you're present when Kirstine calls your name. Anyone who doesn't respond will be recorded as giving their apologies.
Councillor Dr. Barnard.
Present.
Councillor Birch.
Present.
Councillor Brunel Walker.
Present.
Abby Thomas.
Present.
Kelly Williams.
Present.
Charlotte Pavitt.
Present.
Elena Rozelle.
Present.
Chief Inspector Andrew Cranage. Philip Cook.
Present.
Are there any other persons present whom I've not called? Please turn on your microphone and advise when I call your name. Timothy Whedon.
Present.
Paul Betterson. Maureen Mandawahi.
Present.
Tessa Lindfield. Are there any other participants in attendance? Please advise that you're present via the meetings chat and you'll then be asked to turn on your microphone and confirm. There are no indications in the meeting chat that anyone else is in attendance. Thank you. Thank you, Chairman. I've got a notification from Fiona Slevin-Brown.
Present, Chair.
Thank you. Thank you, Chairman.
Great, thank you. Item 2 is declarations of interest. Does any member have any disclosable pecuniary interest or an affected interest to declare in the meeting? No? Okay, so we shall move on. Agenda item 3, are there any urgent items of business for consideration?
I'm not aware of any, Chairman.
Thank you. And for item 4, I believe we don't have any questions from the public at this time.
I'm not aware of any questions from members of the public that have been submitted to the committee Dropbox.
Okay. Sorry, I'm just looking for the action log to run through, but are we happy to take the item on action log as read and note?
Yes.
Okay, and now we shall move on to, sorry, my screen's just frozen. The next item is really to review the current data and the levels of COVID-19 infection rates in the borough. Over to you, Charlotte, and a very warm welcome to the council.
Thank you. Thank you. I'm going to share my screen for the presentation. Just bear with me. Okay. Is everybody able to see the title slide?
Yeah.
Okay.
Yeah.
So this is we're going to review both the data and the local alert levels, which are the next 2 agenda items, in parallel, really, because it makes sense to flow from one to the other. But I will pause after the data session just to give time for any questions or points of clarification. So what we want to review and consider today is what the data is telling us and the scale of the pandemic in Bracknell Forest and our areas of concern, and then also consider the 3 local alert levels that have been published and what that means for Bracknell. And then a later agenda item we'll revisit and look at the insight and response, bearing in mind what's presented within these 2 agenda items in terms of implementing non-pharmaceutical interventions locally. So that's what we're actually going to be doing locally. So in summary, the data is telling us that while cases in Bracknell Forest are at a comparatively low rate compared to neighbouring areas and across the country, they are beginning now to increase rapidly. I just need to minimise So here we go. This table shows Bracknell Forest. We're considering the 7-day rate per 100,000 population, which is the position compared to the previous week. Now, this data is for the 7th to the 13th of October, because it's what was published at the point of publishing the slides. So we can see that we had 56.3 cases per 100,000 population. That was an increase on the previous week. That was lower than the 65.8 cases per 100,000 in the southeast, and considerably lower than the 166.7 cases in England. What we have got updated data today, so just to insert that into this slide, our current rate in Bracknell is 73.4 cases per 100,000. That's for the period of the 10th of October through to the 16th. So that is a further increase in Bracknell. Across the southeast, the cases are 67.4 per 100,000. So an increase in the southeast, but Bracknell has now exceeded the southeast average. And just also to say, we are in line with our neighbours in Wokingham and Reading, but lower than our neighbours in Slough and the Royal Borough. And just to set some wider context, Nottingham Local Authority has the highest rate this week, with a rate of over 700 cases per 100,000. So whilst our cases are increasing, we're considerably lower than other challenged areas. The next graph looks at the confirmed cases over time. So this dates back to the 1st of September to the week commencing the 7th. And as you can see, Bracknell with the blue line is from the beginning of October is beginning to increase, following the trend in line with the southeast, which is the orange line, sorry, and much lower compared to the grey incline of the England rate. This again is 7-day cases per 100,000 population. So the date for today, which I've just noted, which should be around here, we can see it coming up, and here is the threshold of 100 cases per 100,000, and that's the threshold that's informing a move from level 1 or tier 1 to tier 2 action, which we'll discuss in the next agenda item. But I just want to flag it so we can see that now we are approaching that threshold. We've also done some analysis of our cases and the contacts our cases are having locally within Bracknell Forest. And we know that most of our transmission is in the adult age group between 18 and 64. We are doing some additional analysis to understand that a little bit more and inform our messages effectively. We know also that the vast majority of our transmission is occurring in and between households, over 90% of our transmission. So that's contacts within our household bubble. It's also contacts from household visitors, so individuals that we know, and also contacts from visiting friends and family. So it's the house to house transmission that is a real challenge locally. When we look at who the cases have been in contact with, we also know that the vast majority of our case contacts are within Bracknell Forest itself, or at least within Berkshire. Over 85% were within Bracknell Forest itself. So again, that supports this notion that the transmission is occurring in households. We have had a couple of workplace transmissions, clusters and outbreaks, and several in schools and care homes too. However, we're confident in the response to these outbreaks. They've been quickly contained and little secondary transmission. The challenge locally, we feel, is not outbreaks that we have the control over, it's the general community transmission. And I will pause before moving on to the local alert levels, which is the agenda item, for any questions or queries.
Thank you. Do any members have any questions? Charlotte, just one question from me, if I may, on the data that we share versus a lot of the news. I mean, if you look at the BBC News, for example, today, it has its great little postcode lookup service, and when you put the Bracknell Forest postcode in, it gives a different rate per 100,000 for the period of 12th of October to 18th of October. How do we reassure residents as to what the right number is for our area?
That's a good question. So we have, confusingly, 3 different rates per 100,000. We have the 7-day rate, which is what we've been using within this presentation, and I'll explain why we're using that in a minute. We have a 14-day rate, which is obviously higher, and we have our total cases per 100,000, which gives you a figure in the 500 mark. So they're all accurate, but they are all measuring different things. And what's important for us is for us to continue to use a consistent measure. We've chosen, and we'll continue from this point forward to quote the 7-day case rate per 100,000. That's important because when we're looking at our local alert levels, medium, high and very high, it's one of the key factors that determines a move from level 1 to level 2. So the other information provides a richer picture, but it's that key metric that we need to consistently look at. What I would say on the previous slide with the time series and the graph, I should have highlighted it. Apologies. There was the link to the local Bracknell public health dashboard, which has our up-to-date. It's updated on a daily basis at 11 a.m. and residents and members of the public and other interested parties for our local data should use that link for the most up-to-date, consistent messaging, rather than other sources that draw upon different time periods and slightly different focuses on rates. Does that answer the question?
Thanks, Charlotte. And yeah, it does. And the reason I ask it is that obviously there's a lot of fear and uncertainty out there at the moment. And I think if we're consistent in the number that we're referring to and that process, we have our links to our data for the public. And I think it's just important that if anybody is watching this out as a resident and sees that, it's important to understand the distinction between those data sets, and that the BBC's number is I guess, accurate in the data set that it's looking at with the period of time it's looking at, but it's not the data set that we look at, which is the important one. So thank you for clarifying that.
Indeed. Okay.
Any other questions? No? Charlotte, please feel free to move on.
Okay. So we now have the 3 local alert levels have been published nationally, and what they are they provide local areas. They are applied to an upper tier local authority boundary, and they give a series of interventions that should be applied locally. Currently, Bracknell Forest is in level 1, which is a medium alert level. That represents the national baseline. It's the minimum level of restrictions applicable across England. And we sit within that alert level, and that's reviewed every 28 days. What dictates where you sit is this 7-day cases per 100,000 population. So that's the importance of that measure. It needs to be less than 100 cases to be in this medium level 1, and if we exceed 100 cases per 100,000 over the previous 7 days, it triggers conversations around moving to the next level, which is high. I do have to, it's not the only metric that's considered. Local demographics and testing data is also taken into account, and local discussions within the council, within our local MPs, also are taken into consideration. So the level 2, which is the next level, a high level of alert, is triggered at this 100 cases per 100,000 population, and it includes, we'll visit in a minute, a number of extra interventions that can be applied locally. And then the third and final level is level 3, which is very high, and that gives us, there's no clear published thresholds, that as areas significantly increase in their rates, conversations are had locally and local decisions are made to move into that tier. So that gives the highest level of intervention to be able to be applied locally. So what does that mean locally? We're at medium level. Generally, it's what we're familiar with. Schools, colleges, universities, places of worship, childcare, youth clubs, organised sport are all permitted. The rule of 6 is key. And all of those sites that I mentioned need to be so COVID secure. So it's what we're familiar with. We need to maintain the rule of 6 and not mix any further than that, indoors or outdoors, in any settings. And obviously the important interventions with face coverings, social distancing, it still remains within this this medium threshold. As we move to the next level, level 2, a high local alert level, there's a number of changes that are afoot, and they're highlighted in the red boxes. So over and above what's already being done at the medium level, in addition, or a change, is that rather than the rule of 6 indoors, you're restricted to only mix with your household or a or social bubble indoors. The rule of 6 will still apply for meeting outdoors. So that applies to within your home, within your personal garden, and also with when you meet indoors elsewhere, so in restaurants, pubs, other indoor settings. In terms of residential care, residential care will be closed to external visitors other than in exceptional circumstances such as end-of-life care provision. In terms of travel and transport, travel is still permitted to open venues, but the number of journeys, it's encouraged to reduce the number of journeys wherever possible. And as with the medium level, avoiding travel into any areas that are ranked as a very high area of COVID alert. And then finally, with childcare, in addition to the interventions for medium level, childcare bubbles are introduced for under 14s. And then the interventions that alter as you move into very high, just to sort of state, there's a minimum number of interventions that are applied in the very high bracket. However, there's an additional menu or suite of optional interventions that, depending on the needs and challenges within that local area, they can choose to apply accordingly. So it will mean that interventions in some very high areas will be different from others, and it's the local approach that will inform what that looks like locally. So as and when, if and when we get to that point, that will be discussions that will be had and agreed locally. So what it means is that the rule of 6 will apply in some outdoor settings like parks or public gardens, but indoors and it, again, as in the high category, household and bubbles are only permitted indoors and in personal gardens. What changes with weddings and funerals? The numbers remain the same: 15 guests for a wedding, 30 for a funeral, but wedding receptions are not permitted in high risk areas. In terms of overnight stay, those in area are advised against overnight stays in other parts of the UK, and people outside of the area are advised coming in. And this links to travel and transport, where avoiding really travel into and out of that area. In terms of leisure and gyms, hospitality, entertainment and tourist attraction, again, it comes down to this sort of suite of closures or additional restrictions that are subject to local consultation. In terms of pubs and bars, they must close except where they operate as a restaurant, and they can only serve alcohol with a substantial meal. And then finally, for education, schools, colleges will remain open. Universities will reflect wider restrictions with the options to move to greater online provision. So there is a potential change for university, which locally is not of interest to us. So any questions at this point?
Great, thank you for that very comprehensive set of slides. Do any member of the panel have any questions?
Can I ask a question, Chairman, please?
Go ahead.
Thanks, Charlotte. I think that is the clearest exposition of the differences between the 3 levels that certainly I've seen.
Absolutely.
Really, could you just say something about the financial inducements, if I use that term, the financial implications of being between the different levels? There's push funding and pool funding available, isn't there?
There is. So at level 1, it's a pool funding system where it's £1 per head of population, but we have to write a business case and submit that to say how we're going to utilise that spend. As you move into level 2, it's a £2 per head fund, and that's push funding, so you automatically receive that. And it's also push funding for level 3 also. And forgive me, I will have to double check the amount per head for level 3.
I think it's £3 plus what you negotiate from government.
Chairman, I have a question, if I may. Councillor Birch.
Go ahead.
I've raised it before, but and it's to do with exemptions. And people, and I've experienced it, who don't wear masks in shops and public places, venues, and when challenged, tell you they have an exemption, etc. But when you ask for proof, it's not always forthcoming. And I noticed yesterday or the day before that these charity-based exemption cards are being sold on eBay, etc. Can we get some sort of understanding as to what's happening with these exemption things about face masks? It's very disconcerting for members of the public that are observing face masks properly to see, if you like, non-medically secured or attested exemptions. And can we make some form of representation to the powers that be to get this exemption regime properly regulated and properly dealt with and supported? Because it's quite worrying. Thank you.
Thanks, Dale. I'm not sure who wants to take that one.
How would we, if we are chairman, concerned that there is a way people can just get hold of a piece of paper and then not wear face masks in key public locations? Is there a way and to whom would we make representations to get it properly regulated, so that we don't just have people with scruffy bits of paper walking around claiming that they are exempt? If an exemption is appropriate, then it should be signed off by a medical practitioner, etc., etc. Or better still, if they are warranting some sort of exemption, then they should not be going to public venues, and our shielding organisation can assist. So how can we get, and to whom can we get, some clarity on that and some action?
I'm just going to bring Phil Cook in as well. I think Phil has a question, and then Kelly has a comment as well. Phil, go ahead.
Yeah, thank you. So I just want to add to what Dale's saying, in as much as I do know that local charities in Bracknell Forest area and surrounding areas that support people with learning disabilities, autism, etc., who are a group of people that are exempt, are supporting their service users and clients and advising them accordingly about it, to carry. And actually, if people are selling these passes on eBay, that's ridiculous, because you can just download it from the government website. They're perfectly accessible to all. But I do know the charities that work with those communities locally are trying to give their service users accurate and appropriate advice. However, I do know there are other organisations, such as organisations that work with people with hearing difficulties, where masks present a significant problem if you are a lip reader or if you can't hear, particularly with muffled voice. So they equally are trying to advise their members accordingly, but it doesn't stop then Joe Public downloading a piece of paper and doing something with Adele. I don't think there is an answer to that. Certainly, as far as I'm aware, guidance isn't that it has to be signed off by a medical professional, etc. Because if you're diagnosed with autism, you're diagnosed with autism, you download the pass and you're recommended then to do that. So I just want to say that locally, I do know the charities are doing what they can. So beyond that, I don't know what else can be expected.
Thank you. Chief Executive, you have a comment?
My comment really is that I think, as others have indicated, this is a national issue rather than a local one, and probably the best thing that we can do is use our regular meetings with our local members of parliament to ask them to lobby straight into government on the issue.
I agree. Charlotte, you had a comment as well, or has that been covered?
Yeah, it was just a point to say that we are doing engagement and to inform our messages locally, particularly around individuals not complying. So that's something. Whilst it's not it's a bit grey in terms of non-compliance, but it's something that we could explore as to why this is happening in a local context that could inform some messaging as well. So we can do something locally.
Okay. Does anyone have any further questions on the item?
Chair, it's Councillor Hunt here. I mean, just looking at the data that we've seen so far, and just exploring a little bit about the compliance surrounding wearing face coverings, what seems to be becoming clear today is that in areas of the country where people actually just follow the rules that are in place for their area, that there is evidence that this might be impacting on the rates. And clearly, based on what we're seeing, that if we can work as a community to manage those rates and therefore just comply with what's asked, be it wearing face coverings, be it actually observing the rule of 6 and that social distancing measures, then that is going to be the single biggest thing that will make a difference in Bracknell Forest. Because I was very struck in the data, that this is within Bracknell forest transmission, you know, the vast majority relates to our own community and what's happening in households across our boroughs. So I think that's why the data is important. I also, just one thing on the data. I know this is statistical. Is it significant and concerning that we now appear to have accelerated away from the south of England or the regional average? Because that would suggest to me this is a wake-up call. This is a call to action for all residents in the borough to recognise that, you know, things could get quite challenging and difficult, as we have seen elsewhere. So I'm just interested if we should read anything into that, or whether these statistical anomalies, which some might claim, I don't necessarily believe that, you know, as a cause for concern.
Can I
That's
respond?
a very good question, Charlotte.
Yeah. So what I would say, it's the first week that it's done that. And we need to see if that rate continues next week at least. Whilst numbers are in Bracknell, they are still relatively small, so they are subject. This is an absolute case tracking as opposed to an average that we're tracking, which would minimize what we call the noise around it. So at the moment, I wouldn't be comfortable in saying that this is an absolute trend. It could possibly still be noise. So let's see what happens next week, and if the trajectory is still going up higher than the southeast, then yes, that's the point at which we sort of take note. I would suggest.
Okay, thank you. Any more questions? No? Charlotte, thank you for the presentation, and as the Chief Exec said, that's probably the clearest, best descriptor of the tiering levels that I've seen and heard. So I thank you for that. We'll move on to agenda item 7, which is the shielding arrangements. Abby, I think this is with you.
Thank you, Chairman. I'll just share my screen. So last week, the government published the shielding framework, which sets out the context in which shielding could be reintroduced and the expectations of local authorities in terms of supporting clinically vulnerable people. And have a couple of slides to summarise the approach. So local authorities are responsible with our partners for continuing to support clinically extremely vulnerable people as part of our safeguarding responsibilities. And as you're aware, we have a partnership in place with the ARC and also involve community services to provide a community response service to people who don't have family or friends to help them with tasks such as shopping and prescription collection. So that support is ongoing. However, if we move up through the tier levels that Charlotte has just described and get to a very high risk area and become a very high risk area, then it could be that shielding is reintroduced for a limited period of time, and it would be less restrictive than in the original shielding guidance. The decision to reintroduce shielding will be made by national government in conjunction with the Director for Public Health and also clinicians. And if an area moves into the very high risk tier, then regardless of whether shielding is reintroduced or not, local authorities and their partners would need to provide reactive support to clinically extremely vulnerable people, which we would do through our community response partnership with the ARC. Last week, guidance was also updated to clinically extremely vulnerable people to give them advice about how they need to look after their own health and well-being. And in the event of shielding being introduced, then anyone who's clinically vulnerable would be informed via a letter. They'd be told how long they'd need to shield for, and in very high risk areas, they'd be asked then to stay at home, and they are able to request support through a nationally established national shielding service system, which is currently being launched and used in parts of the country in the very high risk tier area, such as sort of the northwest. The emphasis is very much though on ensuring that anyone that's clinically vulnerable isn't advised to shield for any longer than is necessary, recognising the adverse impact that shielding can have on people's mental and physical health. And as I've mentioned, the decision around the length of time shielding will be introduced will be very much made at a national level by government. So in terms of the expectations of local authorities if shielding is reintroduced in a very high risk area, the approach is flexible. In the previous lockdown, national government took a lead in providing support to clinically vulnerable people. However, in any new introduction of shielding, local authorities are very much asked to lead in providing local support. And it will be up to anyone that is clinically vulnerable to request support through the National Shielding Service. And then councils will be responsible for proactively calling those people and assessing their food and basic support needs, and then facilitating the delivery of that support to anyone that's registered. And that will be support with things like social care needs, food, medicine, and could be a wider range of things such as help with dog walking, or even help with advice on sort of wider health and wellbeing needs. And specifically at this point in time, councils are being asked to prepare for sort of 5 stages. So we're asked to develop a contact strategy for proactively calling any clinically vulnerable areas, prioritising those that have registered themselves for support, anyone that we've supported previously, and also anyone newly added to the clinically extremely vulnerable list. We're asked to also ensure that we have in place plans for a localised support model to ensure people can access food and basic support needs. And as I mentioned, we obviously have this in place through our community response hub. We would also need to prepare for reporting back to the Department for Communities and Local Government on a number of outcome measures around how we're performing in supporting people that are shielding, as well as being prepared for any clinical review points where shielding could be paused, as well as supporting people when shielding comes to an end, as we did during July and early August this year. So that sums up sort of a high-level summary of the guidance, but very happy to take any questions on that. Thank you.
Thanks, Abby. Does anyone have any questions? No? Okay. Thank you very much, Abby, for that. And thanks for putting together that presentation. We'll now move to agenda item 8, which is on non-pharmaceutical interventions. Charlotte, back to you, I think, on this one.
Okay, yeah, so it just, let me share the screen again. Essentially, it's the presentation continuing.
Apologies, I should probably have allowed you to flow the 3 together.
No, it's fine. Okay, can everybody see?
Yep, that's clear, Charlotte.
Okay, great. So, so considering the previous couple of presentations, we know that we're currently at level 1, but our rates are increasing rapidly. We are confident in our response to outbreaks in businesses, schools and care homes. It's the community transmission that is our biggest challenge locally, and spread within and between households. So having pulled all of that local insight together alongside what we've learnt from our partners, those working in the Royal Borough and Slough, where rates are higher than ours and continue to grow faster than ours, we know that proactive communication alone isn't curbing the increasing risk. And now actually that's been our main intervention locally to date, and our rates are now starting to increase, it seems rapidly too. So we also need to consider additional enforcement and test and trace, which we're looking to implement locally from the beginning of November. So whilst we remain in level 1, we can look to also explore those additional interventions. The other learning that we've got from elsewhere across the country, and what may be part of the answer in explaining some of the variation in rates across the country, is this idea of super spreading events or situations. And therefore, that's something too we have local control over in terms of large-scale events going on within the borough, and for us to therefore thoroughly risk assess and work with event organisers to ensure that they are COVID secure and won't lead to further increase in rates. So discussion within the council and with also with the executive members as well. We will continue to closely monitor the data and local intelligence and use that to assess when we change our approach or move levels. We, as we've mentioned, this 7-day rate per 100,000 population is the most clearly cited threshold for moving from level 1 to level 2 once we reach that 100 case mark. But also we have a number of other measures locally, such as positivity rate. This is the rate that indicates what local transmission, the rate of local transmission. So that's something that we can review additionally. We're also going to be reviewing what we term the doubling rate, and this measures how quickly, so it puts a time frame on our rate doubling, and it just gives us a sense as how steep that curve is. Something we're also going to start to look into is hospital admissions locally, to give us some indication of what impact the virus is having on our services, and elsewhere where we're able to with our wider services, so social care services, etc. And as mentioned, we'll continue to monitor outbreaks in our high-risk settings to make sure that we're not seeing a increase in outbreaks that's going beyond our control. So all of that information will continue to be closely monitored. We as a council will then continue with our first pillar of our approach, has been to follow the government guidance, and we will remain doing so. We will advise this board if we consider there's a requirement to deviate from that position, and that would be that this local intelligence is telling us something different. What we have discussed is that actually we need to continue to watch what's happening around us, particularly Wokingham and Reading, where rates are comparable and our travel and transport flows in and between those boroughs are high, and therefore we may need to reconsider our position should either of them move to level 2 before we feel we're cited to. But it's just something else to keep in mind, and that's the approach that we've agreed to date, and that's where I'll stop.
Thank you. I've got a question back on super spreader events, and obviously, opening in 6 weeks' time or 5 weeks' time is a large-scale event happening in Swinley Forest at Whitmore Bog. There's lots of conversations going on about the level of work they're doing with Public Health England and their level of code security. Now, obviously, they operate in a different way to a football event or a mass crowd event, but that's probably the big event in the area that is likely to be viewed as a super spreader. Can you has work been done with them so far yet? Could you maybe give an update on that? Because that has the potential for, if not handled right, to be a problem.
Indeed, yes, we've been working a lot with them over the past couple of months, really. We are working with environmental health colleagues and public health colleagues locally within Bracknell Forest. They've completed very extensive risk assessment, and we have been working with them to refine that and to challenge that risk assessment. They've been very cooperative in receiving our comments, making amendments, coming back. And so very much a partnership approach in ensuring that it is COVID secure. We're looking as a council, looking at the wider implications. There's a fair degree of confidence in making the events COVID secure, but it's everything that surrounds that. So individuals coming into the borough, staying in hotels, transport, etc. So our public health and environmental health approach will extend, and we'll look to work with the hotels that are cited with that event, and we have had discussions also about the individuals who have bought tickets who are now in level 2 or level 3 areas and what that means. And we're happy with how they're responding to those individuals. And we've also talked about what happens when we as Bracknell Forest can potentially move into a level 2 and level 3 scenario, and what that will mean for the event also. So those conversations are still ongoing. It's very much a partnership approach, and yes, very much involved and directing that discussion.
Good, thank you. Any other questions? No? Okay, moving on to agenda item 9, verbal communications and engagement update. Elena.
Morning, thank you, Chair. I haven't got a presentation this morning, but I'm just going to whiz through some of the highlights that we've been doing over the past month and just talk a little bit about the local risk comms that we're doing at the moment as well. So as we discussed previously at the board, youth engagement and youth communications have been a priority for us. This has continued to be a focus for us over the past month. We've been working with people at the train station. We now have quite a big billboard poster in place to reaffirm people should be social distancing. It is actually aimed at young people, and the message is a bit more serious than we would normally do. It's along the lines of why aren't you social distancing, which has been quite popular when we've used that with parks and talking about litter. So we're hoping for the same success. We've also given out some COVID kits at the train station. We did that at the weekend with the Help of Our Youth Council and Councillor Brunel Walker. They included masks, hand sanitizer, and a leaflet about the current situation, how to keep yourself safe. The plan is to actually go back out into the town centre and do that on Friday as well, so we're reaching more people. We've now got a digital media ad running across something called a DAX package, which is a digital package running across things like Spotify, Deezer. If you listen to global radio on an iPhone or an iPad or another device, the adverts that you get are normally into the area that you're in. So everybody listening to those sort of streaming services in Bracknell Forest will be getting our adverts essentially. The advert runs along the lines of young people doing their bit to protect their family as well. So we've really pitched that at young people and the places that they will be listening to that message. The Wear Your Mask campaign continues. We've reached around 50,000 people on digital platforms now. And we also have information on bus backs across the borough, across different routes. We've made provisional inquiries with a local celebrity. We think that this person would resonate quite well with the people that we're trying to reach, certainly younger audiences. And I'll provide more information on that at the next board if we're able to proceed with that. And we've also launched the Community Information Champions, which is quite a big thing for us. We've noticed over the past month that unfortunately some of our media colleagues have been using statistics in a way that perhaps have been quite frightening and panic-inducing to some of our local residents. So to get more of our information out more widely, we've launched a community information champion system whereby people across the borough can sign up. It's totally free. There's not very much work involved for them. We'll send them very sharp bullet points that they can then send on to their family and friends. And it's information they know they can trust and rely on and is accurate. We launched that on Tuesday afternoon, and a quick check this morning. So within 36 hours, we've had just shy of 50 people sign up to be part of that scheme. It's really good. And our partners are also helping us to spread the word as well, which is great. They're the main successes that we've had in general, targeting the harder to reach audiences. In terms of local tier system, we have already sent out a press release. We sent that out last night. It's also on our social media channels. It puts more of an emphasis on people taking responsibility for their own welfare and the welfare of their loved ones as well, and encouraging them to actually do everything they can to protect their loved ones. The responses that we've had so far have been a real mixed bag. It shows us that we do need to do a little bit more work about making people understand that COVID is actually very serious, and we need to push more with compliance of the rules as well, and to make people understand what they need to do and why they need to do it. It is early stages, as I said, with that. It literally only went out yesterday evening. One way we're looking at making that a little bit more impactful is using case studies. We have managed to contact one person within the borough who might be willing to share their story with us, but actually finding those people is a real challenge. Finding people who've been directly impacted and willing to share their story and willing to share it quite widely is quite a challenge for us. So if the board does have anyone they know who might be willing to step into that, then we'd be all ears and we'd be quite happy to make contact. That's a very quick whistle-stop tour through what we've been doing comms-wise, but happy to take any questions.
Thanks, Elena. Any questions from the board?
Yeah, yes, please, Chair. Can I start by saying, Elena, it's absolutely fantastic what we're doing to reach out to our community, as I know we had quite a big discussion about reaching out to young people. How will we gauge success? Because, I mean, the difficult issue, this is around compliance. You know, if when we go back to a spot we've been to before, whether we see a high level of compliance with wearing a face covering, social distancing and things like that, because I'm getting the sense from, you know, feedback from a number of schools that young people, you know, seem to be great, fantastic, seem to be taking this more seriously. So it might be that we can ride that curve and really sort of get the messages home. I'm just so pleased, Chair, and Alana, with what we're doing there, because I think that was a big concern, and be interested to know how we're going to measure impact.
So I think one of the ways, sorry, Mark, one of the ways of measuring impact is just that, is looking around and seeing who is actually complying. We're also using the data that Charlotte is providing regarding levels of positive cases. We know that that is rising, and comms isn't the only thing that is one of the ways that we can tackle that, but it certainly helps shape the way we communicate and who we engage with. And using that data, which I know that we can't always share in the public domain, but that does really help shape our messages and who we target. The other thing that we use as well is metrics that we can see via digital systems. We can see who's engaging and who isn't. So for example, some of the comments yesterday around slightly harder messaging, the comments weren't overly positive, and there is some extra work to do there. However, we can see that within certainly 12 hours, we reached nearly 20,000 people. So while the messages aren't always being received in the way that we would hope for them to be received in terms of positivity and positive comments back, we know that people are reading them and taking that message away. We also need to make sure that our messages don't become stale, and this picks up on a point that Councillor Birch raised a couple of boards ago, whereby he was asking about it becoming like wallpaper. So one of the ways we're trying to do that is finding alternative influencers or alternative celebrities, using case studies and making it quite impactful in terms of making it human, rather than making it the council going out and finger wagging, which we've looked at other councils, certainly in the local area, who've done that, and it hasn't been particularly successful. So we are using peers as a way of improving comms performance as well.
Great, thank you. Chief Exec, you had a question or a comment?
Yes, a question, please. And actually, Elena picked up on it a little bit, but I was in that last answer. But I'm just going to ask her to unpack a little bit about the I think originally it was a mixed bag. You said the reaction to the press release yesterday, because I think the tone that we were trying to adopt yesterday wasn't kind of shouty, but it was just being direct and honest, that this isn't, within the borough, this isn't a disease that's only affecting young people and the very old. The very old are clearly more vulnerable if they get it, but this is a disease across the age ranges. And the point that you said about it's a personal responsibility of everybody to try and contain the spread. So I just wondered a little bit more about the negative reaction to that.
Yeah, so we have quite a few comments on Facebook. When I checked probably about 15-20 minutes ago, there's nearly 200 comments, which is quite a lot for us. Range from people being very positive and supportive and saying that we've all got a job to do to be compliant, everybody's responsibility, but there are also quite a few people on there who simply don't believe that COVID is real. They don't believe that it's any more serious than flu, for example. They're getting quite confused around the numbers, saying that COVID numbers and data is being lumped in with flu admissions to hospital, which isn't correct. So we do need to go back and just unpick some of that and put the facts out there. And actually some of the information that Charlotte provided earlier on in her presentation, we can use that to actually go back and dispel some of those myths. So I think it is actually being a bit more forceful with that data and those statistics where we can, just to bring people on board and make them understand.
So there's people who are just denying the basic facts.
Exactly.
Okay. Thanks, Elena.
I think
Chairman,
I was to say, before I bring Dale in, I think that change in tone is the right thing to have done. I think it's we need to demonstrate the gravity and the seriousness of this. It's not as direct as some other councils have done, but I think it's a measured step up of the language and tone that we're doing. And I think it's, as Elena said, there's a lot of people out there who still just don't believe this is real. And they're going to be hard to convert or hard to change their minds on. But I think the majority of people obviously do believe it's real, but that message was right. Dale?
Yeah, I'm pleased with the negative comments. I think that's a positive sign. And there's a reason for that, in my view, which it's for old people. It's old people that die, not us, youngsters, like myself, of course. But that's the message that people have been living in inverted commas, those brackets that went out in those age ranges. They've more or less been thinking, I'm okay. It's older people. Now that we're dropping that message into their psyche that says, actually, it could be you, they don't like that. So the fact that it's getting through and they are coming back saying it's negative and don't like this, that I believe is an indication that that message is getting through. And so I'm pleased, inverted commas, from the marketing aspect, that we are now sending the subtle wake-up call to the right sectors of our community. Does that make sense? It's almost the positive negative.
Yeah, totally. I think it's that old adage that all publicity is good publicity in this case, because it's getting that message through.
Amen. Yep.
Okay, anything else on
the coffee?
Yeah. I mean, Chair, I think the messaging is absolutely spot on. because, as we said, it's gauged to reaction. How do we try from this point in to maintain that degree of engagement, and particularly to try and reach the harder to reach people? And by the harder to reach people, I mean those that don't actively engage with social media, and those who still actually pick up some of what they do through, you know, print media and things like that. I mean, I think the billboard at the station is absolutely spot on, because I think it's really, you know, got people talking and thinking. Are there any other mechanisms which might be seen to be a bit quirky? I mean, I know in the past, like one of these trucks that drives around with sort of signs either side, but because this is a really, I can recognise and understand that in our population there's a measure of fatigue, you know, amongst our residents. You know, this thing has been going on and on and on, and they're being asked to do more and more, as they were asked to do back at the beginning of this year, but the fundamentals haven't really changed in terms of actually trying to manage this in our community. So, I mean, I'm just really asking, I mean, are we open to try and think of other ways of just, you know, putting that message out, maybe just doing a little bit more work with the schools, because they put out some fantastic regular messaging, but maybe ask them to add a paragraph. This is about the whole family. This is about your household as well. I don't know, anything to try and reach more and more people, because, you know, if you look at the numbers, if we hit the right 10 families with the right message, we can completely change the dynamic in Bracknell Forest.
Yep, so it's just the start really of this campaign. So other things that we already have in the pipeline, which are in draft, is an all household leaflet to go through to everybody's door. It's quite short and sharp, but it gets the main messages across. We also have things like Town and Country, the winter edition coming up, which goes to everybody's door, which we will use. Absolutely right, we will speak to our schools and the college as well to see how we can work in partnership with them. Other things that we've looked at is around billboards. So for example, there's a big one in Market Street, which gets quite a lot of traffic past it. So we're looking to see if we can spread it across sort of out of office media, it's called, whether we can do that across billboards, petrol pumps, those kind of things as well. So we are looking to take it wider, because we recognise that not everybody is on social media.
Thank you very much, Alana. I mean, that's really creative and really positive, and you know, all we can do is put the message out and hope that the vast majority of people actually take it at face value for what it is. Thank you.
Great. Abby, is that a comment that is that just an update on chat, or is that a comment you'd like to make?
Yeah, just to say that this week we've sort of pulled together colleagues from Bracknell and Wokingham College, also schools and representatives of the youth service. So we're looking at further ways in which we can engage and involve young people, which we'll be able to report back on at the next meeting.
Great, thanks for that. I shall move on if there's nothing else. In fact, I think we've dealt with the action log at the top of the meeting rather than at the end of the meeting. There was just one comment in that came up from before, which is about more proactive, or sorry, reactive messages that can be pre-approved to go out. I think I've seen some of the garish coloured ones from other authorities. Do we need to? Is that something we can close off? Is that being overtaken by other events?
I can pick up on that one, Mark. Yes, we have started to prepare some extra messages. I think it has probably been superseded, certainly by the tier levels coming in, but we have started preparing messages for if we go into different tiers, so that is in hand. That's
fine, great, thank you. In which case, if there is no other business to cover off this morning, the next scheduled meeting is on the 19th of November at 9:30. But I'll just go around in case there's any other questions. That apologies, and I've just been reminded, one of the items is that we actually need to approve the updated terms of reference that were circulated. Apologies. Has every member seen the updated terms of reference that have been put forward?
Yes. Yep.
And is everyone happy, or I will go by dissent if anyone is objecting?
Content, Chairman. Content.
Yep, agreed.
Great.
Agreed.
Okay. Thanks to that, no one is saying no, in which case those are approved, and I now declare this